Hi there, I'm Kelly O'Donnell, one of your National Vice Presidents here in AmeriPlan. We are going to talk about the MedPlus program. I'm going to give you the basics of the plan, along with some frequently asked questions that your clients may have about the program. So MedPlus, what is it? It's $24.95 a month with a $20 registration fee in their first month. The program has telemedicine, pharmaceutical, hospital advocacy, and ancillary services like x-rays, lab work, and MRIs. So in this program, what does each portion do? What's it all about? Okay, so the telemedicine, first and foremost, is like having a doctor on call in your home 24/7. You can call up at any time, ask questions related to the health of anyone under your roof, and they'll give you advice for free. If you want to use the telemedicine to make what they call a diagnostic call, it costs $25. You call up, you will have a doctor call you back within an hour or two, and they will ask you what the symptoms are, and if they can prescribe medication over the phone, they will. Now, this is a fantastic service. $25, it's like seeing the doctor. If you go to an urgent care, it's going to cost at least $75, but you can call up, get a $25 diagnosis, and then they will call in your medication to a pharmacy, and that pharmacy will discount your medication by way of AmeriPlan as well. Our pharmaceutical discount is the most volatile part of our plan. Pharmaceutical is one of those tricky things. If they have one company that makes the medication, they can charge the moon for that drug and get it, and there's very little wiggle room for a discount. If that drug is made by two companies, we get a discounted rate. If it's made by three, we get a better discounted rate. And if that pharmaceutical has got itself a generic, oftentimes we can beat the price that you're paying as a copay with your insurance plan. Now, can you use the pharmaceutical alongside an insurance plan? The answer is no. Pharmaceutical, they will take one of your plans. At mine, I give them both cards. My kids are on an insurance plan, and they have an insurance card, and they also have AmeriPlan. So I will ask the pharmacy to run it both ways, and whichever way is cheaper is the way I want the medication. So oftentimes, 50% of the time, it's cheaper to use my AmeriPlan card, and I would go with that. So it doesn't hurt to ask. Telemedicine, I have never had an incident where they haven't been able to diagnose by phone. Things like a bladder infection, eye infection. My son had a burn on his arm, and they prescribed a cream for that. You can take photos and upload them into your back office, but you can also just do everything by phone. It's a fantastic service. So moving on, we've got telemedicine, pharmaceutical. Let's talk about hospital advocacy. Hospital advocacy. That part of our program is real unique and fantastic. Anything that goes over $2,500 in a hospital situation, which these days is sometimes even stitches, you have the ability to be able to advocate that service. So you go into the hospital as a cash patient. If you go into the hospital and say, I have AmeriPlan, the hospital's not going to know what that means. So you go in, you tell the hospital you are a cash patient, you pay whatever you need to pay to leave, which is usually about $100 to go home. As you know, at hospitals, they don't know right then and there what things are going to cost. So you pay your $100, you go home, and you wait for the hospital to send you the bills. As you get the bills, you are going to call our patient liaison and have them assign you somebody to help advocate your program. So when you go in to the advocate, they're going to take all your bills, and they're going to say, okay, here's how much this costs. Here's how much our client's willing to pay. Now, there's other factors that go into that, but our average patient saves 80% on their hospital bills. You heard me right, 80%. It's pretty amazing. And so I've had patients that have gone in for open heart surgery, $100,000 or more bills, paying absolutely zero for their hospital stay. So it's really a fantastic program. You want to get an advocate on it right away so that when those bills start coming in, they can really start working on your behalf. Hospital advocacy, you have a $2,500 beginning for that program, and then anything after that, you would be able to advocate, and our advocates are fantastic, top notch. Moving on to the ancillary services, the x-rays, the MRIs, the lab work. This is also an incredible part of our program. The lab work Oftentimes, if you're paying out of pocket for that $100, $200, $300 just for the general lab work that you would be getting done each year to make sure that you're healthy. On AmeriPlan, the most common lab work that you get done is called the complete blood count. And your complete blood counts are usually about $110. On our plan, it's $14. And you can go to Quest Diagnostics, LabCorp. You just have to go through MedStat in order to get that done. Now, MedStat will give you the order, and you can go in and get the lab work drawn at any of the locations that they offer to you. Now, interesting part of the LabCorp and MedStat program is that you don't have to have a doctor's order in order to get your lab work drawn. So if you know what lab work you get drawn each and every year, you know, your cholesterol and your things like that, you don't need to see a doctor first, get your labs drawn. You can get your labs drawn. They will send your results to either your doctor, yourself, or both. Fantastic way to save money. MRIs, x-rays will be in the 50% off range. I did even better than that on my MRI. I had it done at a local imaging center, very nice center. What would have cost on my MRI for my knee would have cost $2,400, wound up costing me $304. I had a client ask me about it, and she said, "There's no way that's what it cost you." And I sent her my bill, and she was in disbelief over it. So our program works to discount the services if you're paying cash. If you have a very high deductible with your insurance plan and they're not negotiating on your behalf in the meantime, that's where we fit in nicely. We fit in for those clients who are right above that Medicare line. For people who can't afford to get insurance, we're a great alternative to help them save money as they go and get things done that they need done along the way. Now, sometimes clients will ask, well, can I go see my doctor on this plan? Primary care doctors and specialists aren't covered on our program, and with very good reason. If you go to your primary care doctor, you're going maybe once, maybe twice a year to see that doctor. And if you're a cash patient, they will more than likely discount your fees directly anyway. We think it's better to put our resources into the things that cost a lot more money, like your MRIs, like your x-rays, like your hospital stays, the telemedicine for the day-to-day stuff. You can use if you have a cough, if you have a flu, if you have an ear infection, you can call that in for a $25 fee. And so primary care and specialists are not part of this plan's designation. Now, sometimes clients will ask, can I use this alongside my insurance? The answer is kind of no, but then there's a little bit of a yes in there too. So if you have an insurance plan, we are not competing with your $20 copay. We're not really set up to be the company that comes in and helps you cover the cost of your copay. If you're paying $800 or $900 a month for health insurance and you say, yeah, but I go to the doctor and I spend only $20. Well, from my perspective, that's $820 if you went to the doctor that one month. That's a lot of money. Our plans are $24.95. If you went and saw a doctor 8 times that month, you might spend that $800. But people generally use insurance to cover themselves in the event of an emergency. Well, that's where our advocacy program kicks in for our clients. If you have an insurance plan in place and you're paying a deductible before your insurance kicks in, that's where AmeriPlan can shine. We can help you pay down your deductible in the meantime. Oftentimes our clients will say, well, where can I go to get the work done? Or where do I call for the telemedicine and things like that? Once your client signs on for the plan, they can go to AmeriPlan.com, and up top they'll see a link that says Members. They click that link, they can log in and use the Member Services back office. For each part of their plan, they can log in and see the telemedicine phone number, the telemedicine back office. You can also see what ends up happening with your MRIs and your x-rays and your lab work and such back there. So they just need to log in to be able to see that stuff, as do you. I hope this has been informative for you in the use of our MedPlus program. I gave you the basics, but also a lot of the questions that your new member might ask. I hope you've enjoyed this segment. Thanks so much. Bye.